Our goal is your satisfaction. Let us show you the way.
What are the signs and symptoms of a skull fracture? Symptoms of a skull fracture include tenderness, swelling, symptoms of bleeding in the brain, which may gradually worsen or suddenly appear, include sudden severe headache, seizures, nausea or repeated vomiting, lethargy, weakness in an arm or leg, loss of consciousness. When should you go to the doctor after hitting your head? See a doctor within 1 to 2 days of a significant head injury with ongoing symptoms, even if emergency care isn't required. Seek emergency medical attention if your child experiences unconsciousness, confusion or disorientation after a head injury. Should I go to the ER if I hit my head? Emmerman says patients who've suffered a head injury should visit the emergency department immediately if they lost consciousness or became confused, disoriented after they were injured, suffered the injury at a high-speed car or bike accident, a steep fall, etc., are vomiting or feel nauseated. How do you know if a bump on the head is serious? When to see a doctor for a bump on the head? A bulging soft spot on the top of the head, more than expected swelling or bruising, more fussiness or sleepiness than normal, vomiting, loss of consciousness or fainting immediately after hitting their head. What are the symptoms of a slow brain bleed? As more blood fills your brain or the narrow space between your brain and skull, other signs and symptoms may become apparent, such as lethargy, seizures, unconsciousness, when to see a doctor, lose consciousness, have a persistent headache, experience vomiting, weakness, blurred vision, unsteadiness.
Take our lead. Let's help you make your mark.